Hi, Joan?
Yes.
Hi, I'm Emily. I'm your physical therapist for today. Can you just verify your last name for me, please?
Southwell.
Yes.
Southwell.
Okay, and lastly, your birth date, just to verify.
February 4th.
Okay, great. And so what brings you in today?
Well, it's my wrist.
Okay.
I broke it about 5 years ago, and it just does not do what it needs to do. It doesn't have enough range of motion, and it feels a little weak sometimes.
Okay. How did you break it?
I fell. I tripped, and I fell. And I had something in my hand, and I just went down on it like that.
Okay. And you said this was about 5 years ago?
About 5 years ago.
Okay. Did it happen at home or at work?
At work.
At work? What do you do for work?
I teach preschool.
Okay. And so this was daytime then?
Yeah, it was. Afternoon.
Afternoon? Was it indoors or outdoors?
It was outside.
Outside? Okay. And when you broke it, did you have any surgery afterwards, or did you get any treatment whatsoever, cast, anything like that?
Yeah, I went to the emergency room, and they pushed the bone back together because it was a little bit off. And then they put a cast on it.
Okay. How long do you know you were in the cast for?
I think it was about 6 weeks.
6 weeks? Okay. Did you go to physical therapy after?
I did.
Okay. And how did you like that?
I loved it.
Okay. All right. Do you know how long you did physical therapy for?
I don't.
No? Okay.
No.
Okay, that's fine. And so how long has it been since your last physical therapy appointment to right now?
I think about 5 years.
5 years? Okay. And is it painful when you move it, or is it just weak?
It's not painful.
No pain?
But it's just weak, and this is my dominant hand, so it seems like it should be the stronger one, but they're not. They're about the same.
About the same. Okay. And is there anything that you want, any goals that you have for what you want to do with your wrist?
I just don't want to notice it. I want it to just feel like it always did before, strong.
Stronger. Okay. So have you had any other surgeries? Not from the wrist, but for other things?
No.
No? Are you on any medication?
I am. I have osteopenia,
Okay.
so I'm on Fosamax for that.
Okay. And how long have you had osteopenia for?
I would say, I don't think I had it when I broke my wrist. Well, maybe I did. I think I did, actually, because I was taking Fosamax
Okay.
when I broke my wrist, and then they took me off it because they were afraid it was making my bones brittle. But now they put me back on.
Okay. And how often do you take that?
Once a week.
Okay. Do you take any other medications or supplements?
I take vitamins.
Oh, yeah? What type of vitamins?
I take calcium and a multivitamin.
Okay.
And I take glucosamine. And I take Pepsid for my stomach.
Okay. And do you have any allergies to medications?
Not that I know of.
What's your living situation? Do you live in a house or apartment?
I live in a 2-story house.
2-story house. Okay. Do you live with anyone?
My cats,
Okay.
Louie and Ella.
Okay. Cute. I love cats. Do you drive?
I do.
Okay. And do you drive to work or?
I drive to work.
Okay.
It's about a mile. It's close.
Mm-hmm. And do you do any other recreational activities?
I do. I do yoga.
Okay.
And I do aerobics, low impact.
Mm-hmm.
And I ride a cute little horse.
Oh yeah? How often do you ride?
3 or 4 times a week. Trixie.
Do you notice the wrist bothering you when you ride?
The only time is when I'm lifting the saddle on and off.
Okay.
Feels a little weak sometimes.
Okay. What about with yoga or aerobics?
With yoga, yeah, if we're doing maybe down dog or something like that, or plank, this wrist gets tired.
Okay. Do you do any things other than physical activity? Anything on the weekends for fun? Do you go out and have drinks with friends? No. Do you drink any alcohol?
Once in a while.
Okay. So like 2 beers a day?
I don't like beer.
Oh, okay. Sorry. Two drinks a day?
A cocktail maybe once or twice a month.
Okay. And do you smoke cigarettes?
No.
No. Okay. Do you smoke anything else?
No.
Okay. Do you do any other recreational drugs?
No.
Okay. These are all things I have to ask Miss Southwell.
Seems odd.
So on a scale of 1 to 10, 1 being no pain, 10 being excruciating, emergency room pain, do you have any pain right now?
In my wrist?
Or anywhere?
No.
Okay. That's good. And you said your goals are just to make that right hand stronger than as it was before the accident, correct?
Yeah.
Okay, that sounds good. All right, so now I'm just going to take some vitals, do a few tests. I'm going to go through a couple things just to make sure everything's working properly. And then we'll go through some of your concerns, and we'll see some posture. We'll check out your gait. Just make sure everything's kind of in working order before we set up any treatment for you, okay? Do you have any questions for me at this moment?
No.
No? Okay. All right. So first I'm going to have you fill out this form. It's a dash. It's just a survey on how you feel your functions of your wrist are at the moment. So I'm just going to have you fill this out while I gather some things to get the test for, okay?
All right. Thank you.
Thank you. All right, thank you for filling that out.
You're welcome.
So next I'm going to check your blood pressure. Have you ever had your blood pressure taken before?
Yeah.
Okay. I'm going to need you to take off just this arm of your jacket for me, please. Good. Just cleaning my stethoscope. Make sure it's all in working order. Okay.
I'm not supposed to cross my legs.
That's true. Very well versed in this. So where do you teach?
In Sierra Madre. Have you been there
Oh, I
before?
love Sierra Madre. It's a great city.
Town.
Town.
Yes, it is a city.
Mm-hmm. Quaint. Very quaint. Alright, just going to rest your arm right there. Good. Everything looks okay.
Can I put my jacket back on?
Sure.
It's cold in here.
I know, we like to keep it a nice frigid 60 degrees. Alright, here, let me help you with that. next, your heart rate. Over here. Is your heart rate pretty fast or slow? Do you know?
It's usually pretty slow.
I'm just going to check some other pulses just to be sure. Make sure they're all intact. One. Okay, good. That's good.
You're very thorough.
Well, you just have to make sure everything's okay before we take any other steps. Alright. We'll look at your lymph nodes in your neck next, okay? Make sure they're not swollen. Sometimes when you're sick, they swell up a bit. I'm going to check under your armpit, okay? Alright. Let's check out your skin. You ever had a problem with dry skin at all?
Always.
Always?
Mm-hmm.
Yeah.
I soak up moisturizer.
Yeah. It's very dry here. Color looks good. A little dry, but nothing alarming. You don't seem dehydrated at all. That's pretty good. You've been drinking lots of water.
I have.
Good. Okay. So next, what I want you to do is, I just want to see how much range of motion you do have in your arms and your wrists and your fingers. If you could stand up for me, please.
Okay.
Okay. I'm going to have you bring your arms up. Good. Good. And down. Good. I'm going to have you bring your arms bent up like this. Kind of go as far as you can and in. Good. Can you go up in front? Good. And back as far as you can. Good. What about the other side? Up as far as you can. Good. And back. Good. All right. Now I'm going to have you bring your arms out. Have you go as far as you can and down as far as you can. Good. Can you go to the side a little bit and in? Good. How about fingers? Can you spread your fingers out? Good. Good. Can you do circles with your thumbs?
That hurts a bit.
Hurts a little bit? Okay. What about pinkies? Good. Can you put your thumb and pinky together? Thumb and pinky. It's okay. There we go. Good. And can I have you squeeze my fingers, please, with your wrists? You know, tight. Squeeze, 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 squeeze. Good. Okay, relax. Good. All right. Any pain with any of that?
Just my thumbs.
Just your thumbs? Okay. Next, I'm going to have you can have a seat for me. I'm going to test some of your muscle strength, okay? And your muscles and how they're innervated. Just want to make sure that your spinal cord is working okay, too. All right, so what I want you to do is I want you to bring your arms up to the side. Good. And I'm going to put some resistance on this arm first, okay? And I don't want you to let me push it down, okay? Just keep it up, 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 up. Push, 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 push. Okay, relax. Good. Let me try this one next. Okay, don't let me push it down. Okay, ready? 1, 2, 3, push, 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 push. All right, good. Relax. All right, next one I want you to do is I'm going to have you bend your arm this way, and I'm going to try to straighten it, and I don't want you to let me straighten it, okay? Ready? All right. Push, 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 push. Good. Relax. Good one. Okay. Push. Good. Relax. All right, anything with that?
No.
No? All right, next one I want you to kind of grab my hand like this, and I want you to push me away, okay? So I'm going to push back, so don't let me push you back, okay? Ready? Push, 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 push. Good. All right. Try the other side. All right. Push, 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 push. All right. Good. That's good. Okay. Anything with that?
No.
All right. Next one, I'm going to have you bend your wrists for me. Yeah. Okay. I'm going to have you keep your arms straight, and I'm going to push down like this, and I don't want you to let me push it down, okay? Push, 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 push. Good. Other one. Let me push down. Good. Okay. Next one is I'm going to have you bring your fingers out as far as you can. I want you to keep them there, and I don't want you to let me push them together, okay? Ready? Push. Good. Side. Good. Okay. Sounds good. So next I'm going to test some sensations. Have you felt any tingling or any weird numbness at all?
On my fingers.
On your fingers? Okay. I'm going to have you take your jacket off again just for this next few tests. Okay, so
You're gonna poke me with something?
it's just a safety pin. There we go. Don't worry. Okay, so the next I'm just gonna do just a first kind of general screen. I'm gonna touch both sides of your arms and your hands and your fingers, and I want you to let me know if it feels the same on each side, or if it feels you can feel it on one side, and if you can't feel it on the other. Okay. But for this one, I want you to keep your eyes closed. Okay? All right. That's that. Same? Same. Okay, turn your hands out. Same thing, okay? All right, so next I'm going to use this slight brush, okay? It's not a tickle, it's called a light touch sensation, okay? So I'm going to touch you just on one arm, one or the other, and I want you to tell me if you feel it and point to where you feel it. So if I do it on the right elbow, you can point with your left arm, left finger. Point to where, okay? This one also keep your eyes closed, okay?
Okay.
Good. Okay, everything is good. All right, actually one more, just real quick. So the next one is just to test your pain, to see if you can differentiate a pain touch from a dull touch, okay? And so I'm going to have you close your eyes again. I'm going to do either a dull, here, I have a clean safety pin here, so don't worry. I'm just going to show you what it feels like, okay? So this is dull, and that's sharp. Okay? Is that okay?
Yeah.
Okay, so I'm just going to have you tell me which is dull and when it's sharp. You don't have to say where, just say sharp or dull. Okay? So this one again, I'm going to do both sides too, just to see if your right arm is any different from your left arm, okay? All right.
Dull. 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 Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Dull. Okay, that was sharp.
Okay.
Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Sharp.
Okay. Good. See, that wasn't so bad.
No, I thought it'd be easier to tell.
All right.
Can I put my jacket on now?
Just one more minute. Sorry, this will only take a
You're going to
couple
hand me the
seconds.
hammer now.
We're just going to test some of your reflexes. You ever had your reflex done in your knee before?
Yeah, that's
Yes.
funny.
Yeah. So it's the same idea, it's just for your arms. Alright, so we're just going to do a few, okay? Just kind of rest your arm. Try to relax as much as you can, okay? Okay. Good. All looks good. Now you can put on your jacket.
Thank you.
Okay. So next I'm going to test some cranial nerves, just to make sure everything in your spinal cord and your brain is working. There's a few different tests that we do for these, so I'm just kind of going to go through them and I'll explain them along the way. The first one is actually, so I want you to close your eyes for me, and I want you to tell me what you smell, okay?
Lavender.
Lavender, okay. Alright, you can open your eyes. And the next one is, I'm going to have you look at me, and I'm going to put my hand right here, and I want you to look over this shoulder first, okay? I'm going to shine a light in your eye, and I just want you to keep staring in this side. Okay. Good. Alright, now I'm going to have you do the same thing, but with this shoulder, okay? Now, I'm going to have you follow with your eyes the paintbrush, okay? So, and I don't want you to move your head when you do it. Keep your head still and just follow the path of the paintbrush. Okay?
Okay.
All right. And the next one, I'm going to have you kind of clench your teeth. Good. I'm going to open, kind of unclench and clench. Fine. Good. Good. Up here. Good. All right. Any pain with that? Okay. next I'm going to have you make some facial expressions, okay? So I want you to pucker your lips. Good. Can you raise your eyebrows? Good. Can you, like you're smelling your bad smells, push your face. Good. Can you blow your cheeks? Good. Can you make a frowny face? Can you smiley face? Good. And
preschool stuff.
and can you close your eyes really hard? Good. All right. That looks good. All right. The next one I want you to do is I'm going to have you swallow, and I'm just going to feel things just on your neck, okay? So I'm going to have you swallow a couple times. Swallow. Good. One more time. Good. Does that feel okay? Okay, now I'm going to have you turn your head to the side. Good. And the other side. Can you shrug your shoulders for me? Good. All right, now I'm going to do it again with resistance, okay? Shrug your shoulders. Good. Okay, relax. All right, now I'm going to have you stand up. And I want you to balance on one leg, okay?
Can I stand on the hard floor?
Yeah, of course.
It's easier.
Yeah, balance, okay? Stand on one leg. Good. Time you. Okay, good. Let's try the other leg. Good. Okay. All right, so now I'm going to sit back down. All right, last one. I want you to stick your tongue out. Can you point your tongue up towards the ceiling? And tongue down. Good. Can you do it to the side? Other side? Okay, now I'm going to have you push it through your cheek. Good. I'm going to push against it. Don't let me push it back, okay? Good. Can you do this? Can you do the other side? Good. All right. Good. All right. Those are all working in perfect order. Okay, so next I'm going to have you do a couple tests for me. I'm going to put this gait belt on you. This is just for safety reasons, just because we're going to be doing some balance work. And I want to make sure that you're safe, just in case they can grab onto something that's not your clothes. Do you have any broken ribs by any chance?
Not that I know.
Okay. Have you had any back surgery recently? All right. Is it okay if I put this on you?
Yeah.
Okay.
Stand up.
That's okay. Okay. Is that too tight?
No.
So I'm going to have you do some coordination stuff for me. I'm going to have you stand up, and I want you to walk from here to the stool over there on your toes, please. Good. And can you come back on your heels, please? Good. All right. Now I'm going to have you do the same thing, but I'm going to have you walk one foot in front of the other, heel to toe, okay?
Okay. But not on my toes.
No. You can go flat feet for this one. Okay, and come back. Okay, good. All right, so now I'm going to have you sit down. All right, now I want you to kind of have you slap your hands back and forth. Good. You stick out your finger like this, and I want you to touch your finger to your nose, back and forth.
It's far away.
You go over there. Good. A couple times. Good. All right. And next I'm going to have you kind of wiggle your toes back and forth, tap, 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 alternating. Good. All right. So next I'm going to just assess your postures, make sure everything is kind of in line. I know you said you hurt your wrist falling, so I just want to make sure that there's not some posture issue that can maybe attribute to your lack of balance. But your balance seems pretty good, so I'm not too worried. But still get it tested anyway. So I'm going to have you stand up. Okay, just kind of stay right there. And I'm just going to have to look at some things. Okay, alright. Alright, just try to relax as much as you can. You seen any movies lately?
Yes, I have.
What movies have you seen?
I saw The Heat with Melissa McCarthy.
Oh, I love that movie. She's so funny.
She's got a new movie out.
Uh-huh. What movie is it?
I saw a poster. I think it's called The Boss.
Oh, yeah, I did see a poster for that. Who's in that one?
Melissa McCarthy. I don't know who's her, but
Yeah.
her name was big.
Yeah. She's so funny. I love the way she does, like, really silly stuff. But it's funny. It's not dumb at all. Okay, looks good. All right, you can have a seat. Okay, so next I'm going to have you do some tests for me. What I want you to do is I'm going to have you sit at the edge of this table right here. And what I want you to do is, as fast as you can, but safely, I want you to stand up and sit down. And stand up and sit down 5 times, okay?
Okay.
And I'm going to time you.
So faster is better.
Yeah. Okay. You want to try it? Practice one? Ready? Okay. Whenever you're ready, I'll start when you get up. More than 5. Okay, relax. So we're going to do it again because I don't think I explained myself well enough. Actually, what I want you to do is I want you to sit in this chair because this one seems a little bouncy.
It gives you a little bounce.
So I want you to sit down and I want you to go stand up and sit down. Fairly controlled. Okay? So we're going to try it one more time.
Can I use the arms or not?
No, no hands.
Okay.
Okay, we're going to do it again, but this time I want you to do it controlled and do only 5. Okay? Good. That was good. Okay? Alright, so last thing is I'm going to look at your gait and see if you have any problems walking at all. Do you have any problems walking or running? Do you notice any pain when you walk or run?
I don't run.
You don't run? Okay. But walking is fine. Okay, so I'm going to have you walk from here to the end 3 times, okay? Just kind of go at your normal speed. Okay. See? Alright, everything feel okay?
Mm-hmm.
Okay, good. Well, I don't see anything that calls out to me that's a major concern, but we'll definitely work on getting the strength and the range back into your wrist and make it back to, hopefully back to what it used to be. I want to thank you for coming in today and being such a good patient, and I can't wait to get started with you for your treatments.
Me too.
All right.
Thank you, Emily.
Thank you.